Hi, my name is Karen Crespo, and today I will be discussing bipolar disease and the possible treatments that have been proven to work, and side effects, and the possible new treatments available. So, I want to first of all start off with developing more context as to what bipolar disorder is, and the National Institute of Mental Health defines it as manic depressive disease, where you have these like frequent mood shifts from extremely happy to extremely really depressed and sad, and this makes it almost impossible for a person to function properly throughout the day because they're going from really happy to really sad all in one day, all within like a few hours. It's a very fast shift, and it's a very dangerous environment for both people who are around them and themselves because they're not sure what's going on and they're not sure when it's going to be stopped, and it's just very complex and complicated. And through my research, I have found that there is three types of the most common bipolar disease. So there is bipolar disease 1, which is the most common and most severe, and is basically when a person goes from really happy to really sad. So these like mixed episodes of happiness and mania. And mania is defined to be like basically when a person is really excited and really irritable to other people around them because they're so excited and crazy that it's almost impossible for people to be comfortable in that atmosphere, as opposed to the depressive side, which is the other side of a mixed episode where you are constantly depressed and constantly upset about what is going on in your life and the world. So, another type of bipolar disorder is bipolar 2 disorder, which is basically very similar to bipolar 1 disorder. The only difference is that instead of experiencing mania, you experience hypomania, which is basically a very less severe form of mania where you're still pretty irritable to other people around you, but it's just not as severe and crazy as it would be for mania itself. And you still experience the whole depressive side, which is almost similar to bipolar disorder. It's just a little more or less severe. And the last form of bipolar disorder is called cyclothymia. I might be pronouncing that wrong, but it is basically a much less severe form of bipolar 1 and bipolar 2 disorder. To have this like really like mild disorder, you'd have to have these depressive and manic sides for 2 ongoing years to be considered. So, because bipolar disease is considered to be a mental illness, there is a lot of possible treatment and medication that doctors may tell you to take or tell you to do according to what you want. But because we are in America, it is very clear that when you go into a hospital and ask about your mental illness, a lot of doctors will want to prescribe medicine to you directly. This is as stated by the Mental Health Institution, where they're stating that antidepressants and mood stabilizers are the most common form of medication for people with bipolar disorder. So basically, antidepressants is a medication that allows a person to become a lot more happier than they would on their depressive side. So basically altering their entire mood swings to the more happier side, which is again, it can be helpful to people who want to cure it or want to help it, but it's not exactly something that could be used long term. Although it is very amazing that our society has created these medication that is going to be effective to patients, such as antidepressants and mood stabilizers, it's also very evident that there are people out there who not exactly would want to maybe like take those medications. Like, it's not the type of thing that could work for everyone, and that is why the National Mental Health Institution states that it is could be another treatment form so that people could get psychotherapy. And I have realized that instead of like relying on drugs and medication to feel happier and feel better about yourself, I believe that it is better to more like talk your feelings out and talk to a professional about what is going on and what do you think is going on with your body and your mental state of mind, instead of just taking drugs as if like it's a normal thing to do and that it'll be like the main cure to your body. But I think that it could be effective to an extent. I think that if you take those medication drugs and that you rely on it, that's an issue. But if you just take that into consideration that it won't like for sure help you, then that's okay. But I do think that talking your feelings out with a professional in psychotherapy is much better than taking medication blindly. So, to be discussing more of the different types of mood stabilizers, I want to first of all talk about the side effects of each one because there's some clear negative side effects to both medication forms. The most common mood stabilizer is called lithium carbonate, and the possible side effects to this drug is increased urination, increased hunger, increased thirst, hair and skin problems. Some other possible side effects to lithium carbonate is thyroid problems as well as kidney problems as well as lithium toxicity, which is a long list of possible side effects, but there are more side effects to antidepressants. So antidepressants, the possible side effects are general anxiety, separation anxiety, as well as nervousness, as well as suicide tendencies, unusual bruising, and there's more seizures that could be possibly involved. I feel like when people go see doctors and go see professional help, they're not really getting that one-on-one relationship as opposed to what it would be like going into psychotherapy, which is why I think that psychotherapy is probably more effective than just taking medication, because when you're taking medication and relying on drugs for your own happiness, you would come to a state of mind where it can get really hard to feel like you're going to get better because you're alone and you're just taking medication and trusting in a object to make you feel better, when in reality, I think that when you go talk to somebody professional like a psychotherapist about your problems and talk about what you're experiencing, that could first of all create a much better relationship than opposed to relying on a drug. Again, the National State of Mental Illness states that medication is kind of like a placebo effect. It stated that when you come across medication, you think that you will always get better like that because for America, we rely on a fast fix, a fast medication, a fast resolution, when in reality, these type of things take time. So when people rely on medication and drugs, it becomes almost like overly obsessive to the point where people, they take the drugs and they think that, oh, they're better like that. So another person who could possibly help with a mental illness would be a lifestyle manager. The help guide states that as long as the person is getting the best possible nutrients for their body and doing the most physical activity that will benefit them. So if you receive a professional lifestyle manager, you will possibly feel better about yourself and what your mental state of mind is. Thank you so much, Professor Tuttle, for listening to my presentation on my findings and my opinions on the topic of mental illnesses, on bipolar disease and the treatments. I hope you're having a great day. Thank you.